All right, welcome back. We're going to talk about PVA in this video. PVA is patient visit average. We're going to talk about, should we care about it? Is this a number that just our owners or employers talk about? A lot of young clinicians are leaving clinics because their owners are overly focused on numbers. I really want to explore that complex conversation and the way I think young health professionals who are evidence-based and really put their patients first can view and perceive PVA and find a win-win-win that works with owners and employers. So the fundamental question is, should we care about it? I want to dig a little deeper into this relationship. I actually think thriving in private practice is understanding private practice and not thinking of this separation. I've seen this kind of separation of employees and employers. And I think we really need to work together and understand both perspectives. And the more we understand both perspectives of employees and employers, and the more team members understand owners, the more owners understand team members, and the more we all understand private practice, we are going to get closer to thriving in private practice and be that happy, fulfilled practitioner that we're shooting for. So I really shoot for the us and the we space. And this is a lot of thinking from, some of the great publications of leaders in our time, like Simon Sinek and Brené Brown. The book, particularly Infinite Game and Leaders Eat Last by Simon Sinek, talk about the us and the we space. So whenever we bring up a concept, I try to start with, yes, it can appear on the surface as polarizing, employee, employer, but actually how do we come together and make this happen for our clinic and for our patients? So I'm going to bring this to light here. This is, the underservicing, overservicing, if we were to look at it on a scale. So let's start with the left side. We do have some clinicians who come out of clinic and they are very evidence-based. They want to be patient-centered and do the right thing by their clients. And they're often not loving manual therapy as much as, say, traditional physios of 20 to 30 years ago would. And I think a lot of those are really good traits. They're really healthy traits. But what can tend to happen is these clinicians will see someone once or twice. And we're going to get into some clinical mapping and some treatment mapping after this to kind of highlight this. They also, the things that clinician will say is, the patient had all the exercises they need, gave them heaps of education. We had some really good conversation and they understand their conditioning. Their natural history is going to look after them, which is also correct, and they're doing strength work. And I'll do follow-ups on the phone and the email. Now, what I'm going to highlight here is I think both extremes here, the underservicing and the overservicing, is not the place you want to be. And this is obviously open for discussion, and I hope that you discuss this with your team members after you've watched this. I feel that particularly that bottom point of following up in phone or email is not really valuing yourself or the profession. I think we should always follow up in phone or email, but doing it after 1 or 2 visits, I feel we also take on a role as a health coach, changing beliefs, behavior change, lots of education, empowerment, and pink flags. And I think all of those things combined with proper S&C principles of, are we actually making this person more robust? Are they actually stronger than before? I think that's almost impossible in 1 or 2 visits. And this is, this is opinion, but this is the discussions we need to have. I'm going to go to the other side. So the overservices, which I think most of us definitely don't want to be. And I would say young health professionals come out of uni really fearful of being an overservicer, which again, I think that's a healthy belief. So that might look like I'm just seeing them once a week for months. You might be at a clinic where there's patients that have been coming once a week for months, right? And they're maybe in the 20s or 30s or even 50s. And they almost set up themselves for pointless maintenance. And they're the patients that are dependent. And you'll hear them use phrases like, I'm just coming for my regular tune-up. Now, what's important is I don't think we're in a position to say, you don't need that. Don't worry about that, because I don't think that is being patient-centered either. There also are some patients out there that have the money, they have private health insurance, they like the feeling of coming to physio, they feel better, they move better, and that is also okay. So this is, I just wanted to highlight, we don't want to be at the extreme ends here. We want to be in the middle. And so these are all the things I think need to happen with almost any patient that walks in a clinic. We need to kind of develop empathy and understanding. We do take on a role as a bit more of a coach and a mentor, particularly with the BPS lens, and knowing that all those multifactorial things come into someone's cup that affect their outcome and their pain. We want to be pink flags, giving them optimism about the way they move, about the body and the lifestyle they live, is really pumping them up. It's so rare that when you see a health professional, you walk away feeling better about your body and better about your condition. We obviously want to do strengthening, and we want to ideally strengthen them to stronger than they were before in the movement of their choice, and potentially one or two other movements that we think are going to be helpful for them. We want to check in on their response to treatment. Like, how did they go after trying X? How did they go after trying Y? How are they going after 2 weeks? Did they have flare-ups? We can frame all of that, right? The physiotherapy journey is not a straight line. It's actually up and down. But it's very different when a patient leaves the clinic, has a big flare-up. There is an emotional response that happens. And I think we need to be there. I feel saying to someone, you know, you've got all the information you need. If you have a flare-up, that's all right. We don't need another appointment. I think what we see at that point in time is patients go elsewhere and they potentially get set up for failure somewhere else. And also habit formation and behavior change. These things take a long time. That's why I think, you know, the extreme end of 1 or 2 visits is also just as unhealthy as the extreme end of come back every week and be dependent. So running that through our filter, what do we see? You know, what do we see in the clinics? We see that most, and I'm going to, you know, position this as physiotherapy, but run it through your filter. Most physiotherapy clinics who see private patients, it's a mix of people who go to the gym, runners, people in their 30s, up to people who are, you know, seniors, 50, 60, 70 plus, and they have OA. Most of the time, clinics sit between 6 and 12. And I think if you're a clinic that gets lots of EPCs and lots of active people, you're probably at the 6 to 8. If you're a clinic that is lots of private clients and elderly populations that need more of that, you know, kind of OA pathway, they tend to be between 10 and 12. There are clinicians out there that, going to the extreme ends again, 20 or 30 visits. And there are clinicians out there that it's 1 or 2. And I don't think we want to be at the extremes. If we think about 6 to 10 or 8 to 10, it allows for both ends of the spectrum. It allows for, you know, there will be some clients that you only see once or twice. They had a niggle, you did some treatment, they're going stronger, they're already going to the gym, that's cool. There will be some clients that you see 30 or 40 times, like your ACL tear, your surgery stuff, your postnatal women. So if we combine, you know, the 1 to 2 visits, the 20 to 50 visits, what we see in general is people around 6 to 10. And the reason that's important, this goes back a little bit to the module on understanding numbers and private practice, is roughly, if you're getting 4 to 5 clients a week, 4 to 5 new patients per week, and your PVA is around 6 to 10, you will build a healthy and sustainable list of about 35 to 50 clients per week. And again, it depends on your clinic, your city, your pay model. But most physiotherapy practices will need their clinicians sitting between 35 and 55 clients per week. And so that's where those numbers start to become relevant. Now, I wanted to bring this back to something real so we could have a discussion about it. Let's say we have a hamstring case, an acute hamstring, right? On the surface of it, it might feel like, oh, but you know, chronic cases are where we dive into the BPS stuff more. No, with a hamstring tear, we still want to go into their feeling, their thoughts, their beliefs, their expectations about the condition. Maybe they think that their hamstrings are short in length and they need massage to lengthen them. And that's something we need to talk about. Maybe they think genetically their parents always tore their hamstrings, so this is going to keep happening forever. We want to try some manual therapy to relieve their symptoms, maybe up and down the chain. We would start with basic exercises, isometrics. We know that getting people into early running is good. So we're probably at, I don't know, 3 to 5 visits now, 2 weeks in. Then we're going to start at some concentric contractions and work through eccentric contractions. Maybe we're now at weeks 3 to 6. And we know from previous works that when people have a hamstring strain, if they're working on, I'll just say core without going too deep, but if they're working on other trunk muscles and stabilizers, they will get a better outcome than just working on hamstring. And then we need them in game situations and doing sprinting. So we could see that to do all of those wonderful things, to be an evidence-based clinician, to explore thoughts, feelings, and beliefs, and to progress through exercises and strengthening and have that end stage exercise, that's going to be at least 6 to 8 visits. But then let's flip that on its head. Let's say you're someone who sees a lot of chronic people, and this is where the BPS model, all elements of the BPS model are always there all of the time. However, when we talk about acute hamstring, most of the time we would assume it comes with less baggage, although sometimes it doesn't. And when we talk about chronic back pain, most of the time we'll assume it comes with more baggage, although sometimes it doesn't. The argument is that, but chronic people have been overtreated and they only need to be seen once or twice because making them dependent is even worse. We still need to dig into feelings, thoughts, beliefs, and expectations. If you can do that with someone who's had pain for more than 1 or 2 years, I think you're a genius, and it's really unlikely that that would happen in 1 or 2 visits. It's a long, complicated, tangled conversation that requires multiple touch points. We may or may not try manual therapy. If someone's been through the medical ringer and tried all types of manipulation and massage, that might be someone I'm steering away from manual therapy. Or they might be someone where they get a bit of symptomatic relief, they feel really good, they breathe a little easier, they're more liable to do their exercises. We might try it. We want to nudge them in. We want to nudge into their pain and let them know that it's okay with pain using good modern pain science principles. We want to restore confidence in their body and give them those pink flags and address other key lifestyle factors and explore how they would like to live. When I look at that list as a treatment map, again, I think it's impossible to do in 1 or 2 visits. We're really taking the role of a health coach and being psychologically informed. And these are longer conversations, as well as the physiological conversations that might have existed with the hamstring case. So I really start to see that there is that sweet spot of kind of 5 to 10 visits, but no health professional is inspired by numbers. So how do we practically do this? I think as team members, we need to understand that if PVA is coming up, that we actually want to approach it from a clinical standpoint and going into the notes and thinking, how could I have done this better? What would my peers have done? What exercises might have filled the gap? What moments in the consult where a patient said something could I have taken the conversation in a different direction? Unfortunately, a lot of owners talk about it from a numbers standpoint. They talk about PVA and it feels really cold and it doesn't feel patient-centered when your owner comes to you and says, your PVA is 4 and we need it to be 8. I don't think that's the way to go. And I'm just as much working on owners and employers at that end of like, when we talk about PVA, we should be talking about the N=1 case in front of us and filling the knowledge gaps on how to have really good conversations, how to apply some motivational interviewing techniques, how to explore thoughts, beliefs, and expectations, and how to treatment map exercises that actually match with goals rather than just picking a random exercise like a deadlift. To do all of that well will naturally increase your PVA without thinking about PVA. So I want to shift the narrative that PVA is all about numbers and business and money and shift it towards providing a really modern and evidence-based patient experience. So the actions and accountability is, I'd love you to reflect on your PVA, at least know what it is and where it is. And maybe you can look out at your mentors or people around you and see what they're doing. But more importantly than the number, what are they doing in their consult? Why are some clinicians in the same clinic with the same patients you have at 12 and some at 2? And it'd be really interesting to explore. We do this as a group. It's like, what does that person do in their consult that looks different? Are they doing more manual therapy, or that person actually applies exercises for longer and takes them to much harder exercises all the way through? I want you to reflect on how you would best like that to be shown to you. So how are your numbers being reflected back to you? And could you start the conversation with your owner or your mentors on like, I'd love to actually go through this, but from a clinical standpoint. And as always, please put your 1 to 2 takeaways from this. The takeaways is what reinforces the learning for yourself. you'll write it down, you're more likely to apply the principles. And if you could put them in the comments, it benefits us, it benefits yourself, and it benefits future viewers. Thank you, Legends. I hope you enjoyed that module on PVA. Leave any questions below if you have any.